So let's talk of lean PCOS and obese PCOS. So Polycystic Ovary Syndrome affects between 5 and 15% of women with an entire spectrum. Around 50% of women with PCOS are considered to be lean, BMI of less than 23, while the remainder are overweight or obese. Both lean PCOS and obese PCOS share some fundamental features. And what do they include? They include irregular cycles, elevated androgen levels, and polycystic ovaries. However, there are key differences that exist in their metabolic profiles, clinical presentation, and treatment approaches. So let's first look at metabolically insulin resistance is present in both phenotypes following a gradient. Lean controls lean PCOS, obese controls obese PCOS. Obese PCOS women showed significantly higher fasted blood sugar, triglycerides, and LDL cholesterol levels compared to lean PCOS women. Despite normal BMI, lean PCOS women have a higher body fat percentages than expected with what we call as an apple fat distribution pattern. If you look at hormonal differences, a threefold increase in 24-hour mean LH levels occurs in lean PCOS versus a two-fold increase in obese PCOS. If you look at growth hormone, dynamics also differ with increased pulse amplitude in lean PCOS but significantly reduced in obese PCOS. When you look at them clinically, hirsutism and acanthosis nigrans are more common in obese PCOS, while acne occurs more frequently in lean PCOS. Both, in fact, surprisingly face an increased long-term risk of type 2 diabetes, cardiovascular disease, and hormone-dependent cancer, though these risks are generally higher in obese PCOS. From a treatment perspective, each case is different, though while weight loss is considered to be the first step in obese PCOS, patients with lean PCOS benefit from weight maintenance and not losing excessive weight, and in fact building up certain amount of muscle. Both may require medical interventions, and the impact of metformin varies in both. Again, one of the challenges in diagnosis are many cases of lean PCOS seem to get missed, mainly because we forget that a proportion of patients with lean PCOS or lean women may also have PCOS. And that is one of the reasons why we should be focusing more closely on women who may get missed, such as lean PCOS. So again, if you are lean, have irregular periods, have acne, you're more likely to come into the category of lean PCOS, and the treatments may be slightly different.